Good morning and happy Tuesday to you. Hope you're off to a great start in your week. I was talking to a colleague this morning about cancer exercise training, and he asked me who my audience was. And I said, well, it's all health and fitness professionals. He says, you mean doctors, physical therapists, occupational therapists, nurses, naturopaths? And I said, yeah, absolutely, if they're interested in the content. Now, it's understandable that an oncologist knows everything about the cancer surgeries and treatments, and there's nothing that I can probably offer to them in that regard. But they may know little to nothing about exercise and assessment and identifying postural imbalances, faulty biomechanics, range of motion limitations. And then let's say a physical or occupational therapist, they may know how to use a goniometer. They may have, they do. And they know how to do a postural assessment and do all of these corrective exercises. But do they understand the oncology? Do they understand the incision sites, side effects of surgery, side effects of treatment? So you get my drift. The bottom line is we can all learn from each other. I don't claim to be an expert in everything, but what I'm really good at is understanding what happens after a particular cancer surgery, during and after treatment, and how to apply that to exercise programming. You know, what is most important? Do we need to focus on cardiovascular exercise because of damage to the heart and lungs? Do we need to focus on strength training because they are at a high risk for osteoporosis? Do we need to work on balance because they have neuropathy and or they just have poor balance and they're at more risk for falling? And then, of course, doing the strength training and building the bone density is going to help protect them in the event that they do fall, and so on and so forth. And this is all almost like a mathematical equation that we have to put together when we take each of these elements to then come up with this comprehensive exercise program. And we have a lot of people in the fitness profession who are working with cancer patients. Maybe they know it, maybe they don't. Or they think it's out of scope of practice in some countries, so they are not providing this type of course to trainers. But the reality is, out of scope of practice or not, the trainers are still working with cancer patients. The cancer patients are out there, so we need to educate them. And in my particular course, we have 500 pages worth of material. And I only bring that up to give you an idea of how much there is to understand. And the majority of that applies to all cancers, although there are specifics, obviously, for breast cancer, for lung cancer, for lymphoma, and all of those different types of cancer that we cover. But nonetheless, it's so much information. So what is the point of this video this morning? The point is that I implore all of you health and fitness professionals, that includes medical and fitness, to educate yourselves, whether it's through the Cancer Exercise Training Institute or another organization, doesn't matter. But the exercise is such a huge component for long-term survivorship. You know, not only fending off some of the long-term side effects of cancer, damage to the heart and lungs, osteoporosis, diabetes, kidney disease, and kidney failure, all of those repercussions, but it ensures a better quality of life. It enables them to perform their activities of daily living and just all around self-esteem, self-confidence. I could go on, and the studies are there to prove it. So if anybody is interested in learning more, obviously you can go to thecancerspecialist.com. Please join me on our new Facebook page called Survivors Talk. And it is about people's stories who have overcome so many adversities from cancer through exercise, nutrition, and alternative medicine. And I am happy to talk to anybody, anytime. The phone number is 503-502-6776. And if you are not in the United States or Canada and are interested in bringing this training to your country and being able to really help cancer survivors in that next step in the healthcare continuum, please email me at Empower Survivor, and that is EMPOWER, Survivor, at earthlink.net. I hope you all have a wonderful day and look forward to talking to you in the next video. Bye.